Okay, very good. David Silverman in Washington, D.C. area in Maryland. Very happy to be here this evening. We do this presentation every single Thursday night, like clockwork. Usually it's about 30 minutes. Tonight it's going to be about 40. I'm going to go through a new study. So next time I do it, I'll have it condensed down to 30 minutes. I apologize, but I want to get the information across. We do it at 7:30 Eastern, 7:30 Central, 7:30 Mountain, 7:30 Pacific. We do that for a reason. This is a breakthrough that you're learning about. You're probably sitting in someone's living room right now, or you are dialing in long distance, and they've invited you to learn about this. And it's a gift. It's a breakthrough. It's something that you are going to find out about anyway. It's like any breakthrough. You know, the first people that heard about the internet or cell phones or Netflix or whatever, you hear about it enough from enough people and you find out about it. Your friend is sharing a gift with you. It's a true gift. And I hope that you take it seriously. I'm going to go through a couple of slides that are going to answer some questions for you. You're probably going to have some more questions, but this product is experiential and hopefully you'll have an experience quickly. The topical version is Renew 28, and if you were at your friend's house, and we encourage people that are sharing this with people to invite people to their homes. If you're long distance, it's impossible. You get on a Zoom, just log in. But if you get in your home, not only do you get the information, you get an experience. If you have anything that's hurting you, your host probably told you what to do with this, but basically rate your discomfort on a scale of 1 to 10, wherever it is. Shake this up. It's made from salt and water. It's not salt and water anymore. It's patented. We'll talk about that. But if it's your hand, put it on. If it's your neck, just put it on real gently with your fingertips. You don't have to massage it. Put it on 3 times in 5 minutes and watch what happens by the 10th minute. It's quite remarkable. My background is podiatry and foot surgery. I've sold my practice. I do one thing to support my family and have a good quality of life, and that is share this from my heart with anybody that's going to listen. And I'll go through the 6 reasons why people do take the time to listen, and you probably will fit one of these categories. A little bit more about me. I was board certified in foot surgery, foot orthopedics, primary podiatric medicine. I had my own practice and surgery center in Maryland. I've sold it. This is all that I do. This can be very lucrative for people if they're interested in that. If you're interested in the business side of it, you know, everybody should be interested in the health part of it and the anti-aging part of it. But the business side of it, you start on the side and you start telling people, they tell people, and you can build some nice residual income, which is like a passive income that comes while you're sleeping. I got into medicine because I liked helping people. I wanted to have a good living. I did not want to have a boss in my own practice, but I ran out of time. I love what I did, but I found like I wanted more. I loved helping people, but I wanted more time to do other things, enjoy life with my family and everything else. But I was kind of trapped because I had 3 kids going to college and all out of pocket and a good lifestyle, but I was on that treadmill that some of us get on, and I couldn't get off of it. And I was turning into that father I swore I would never be. You know, leaving, go to the hospital at 5:30 in the morning, coming home at 8 o'clock at night, exhausted, getting up and do it again the next day. And while I was with patients, I loved it. The thought of getting on the beltway here and going to work and everything else, it got a little exhausting. Thank goodness I found this. And I didn't look at this for the business, by the way, initially. My friend Debbie brought it to me, like your friend's bringing it to you. The only reason I looked at it was my father. I love my father, and he had an illness, and I wanted to see if this could help him. And that's one of the reasons why people do take the time to look at this. So what I'm going to do is I am going to share my screen, and that's my wife, Wendy. I was on one of the diamond trips. I think that was Costa Rica. They take us on these great trips: Hawaii, St. Thomas, Costa Rica. We're going to Panama in a couple of weeks on the trip, and next year it's in Ireland. Nobody was doing that for me, and while I was practicing podiatry, they weren't saying, "Here, we're taking you on this fantastic trip: airfare, eat, drink, whatever you want." It's a nice bonus for basically for helping people, educating people about this. So here we go. What are the 6 reasons people take the time to look at this and really learn and try it? Well, I shot a video, 6 minutes, 6 reasons. You may have already seen it. If not, save it. It may come in handy because you may want to invite people to next Thursday night or have one in your own home. But it's these 6 reasons that drive people to know about this, to not dismiss it. And when I say dismiss it, say it sounds too good to be true. I read on Google, people say it's salt water, blah, blah, blah. I'm going to show you it's not salt water in a minute. And if you rub this on 10 people that are hurting and watch what happens within 10 minutes, you'll know it's not salt water. But these are the drivers for people. They have a health issue themselves, number one. They have a loved one with a health issue. They lump the anti-aging benefits. They want to look younger. I mean, who doesn't want to look younger? This rejuvenates all the cells of the body, not just the skin, but why not look younger? Athletic performance goes through the roof. We have Olympic gold medalists on this product. People that want to protect their health. This is probably the most important reason, because people that get sick, they didn't all of a sudden get sick unless there was an injury. It was brewing underneath. And then finally it got to the point where, oh my gosh, look, I've got this problem. Now what do people do? They react with medications. So people who want to try to protect their health, we can't claim this cures, heals, treats, prevents anything. And it really doesn't. It's your body that does it. Drugs don't make your body do it. Drugs do it. They cover the symptoms. This does not work like that. And the sixth reason is the opportunity. And I want to touch on this for a minute. Not everybody is struggling financially. There are a lot of people who are. They definitely could use an opportunity on the side of what they're doing that could replace their income or even double their income or more, much more. But there are a lot of people that are struggling financially, but there are a lot of people that are settling financially too. They're making money, good enough money, but it's not really what they want, and they settle. You know, I'm paying my bills. We can't go to that restaurant. We can't go on that vacation. You know, we can't get a new car. This one's old, but you know what? It's okay. That's settling. They're not struggling. They're settling. There are people who look at this opportunity because they're settling with not enough free time, like me. I made good money, but I didn't have the time freedom I wanted. It was my own practice. I didn't have a boss. Thought of a boss makes me sick. I can't imagine answering to anybody, but most of the world lives that way. This gives anybody the ability to be their own boss, build something on the side of what they're doing, and as it grows and amasses and creates this passive income, then they have choices. If they love their job, they can keep doing their job, maybe work less. If they don't like their job, they can quit. It takes time. This is not get rich quick, and I don't claim that it is, because this is not a Ponzi scheme. This is a legitimate business. You'll see in a minute. But there are also people settling with not enough passion. You know, if I were to say to you, give me the feeling you get when I say Friday, right? Good feeling usually for people. How about when I say Monday? Not quite the same feeling. What do people call Wednesday in the office? Hump day. Why? Because you're halfway to the weekend. That's pretty sad that people go through their whole lives. I think they have responsibilities. They got to pay the bills. They don't know they have choices to something like this, but they go through their lives living for the weekend, living for summer vacation, living for retirement, and praying they have enough money and health to enjoy retirement. God, that's 5 days out of 7 that people are not jacked up, you know? And when you find out what this product does and realize the company pays you for helping people and educating people and finding people who want to do the same thing, it's a great feeling. I mean, Monday to me is the same as Friday. It didn't used to be that way. When I was practicing, I love practicing. I love being with my patients, but the thought of going and getting on the beltway and going and leaving my house, you know, when I was in it working with patients, I loved it. You may be the same way. I don't know. But the sixth reason is the opportunity. Let's talk about what this product is, but first let's talk about what it isn't. I'm holding up the bottle of ASEA, and I'm holding up the tube of Renew 28. It's topical, the same technology. What is it not? It's patented, so it's none of these things, because you can't patent a vitamin, a mineral, an antioxidant, or a juice, or an essential oil. These are all really good products that I'm talking about here, but it's not what this is. This has created its own category of product. And these products can do something that nothing else can do, because they contain something that nothing else contains except you. You have in you what's in this bottle and in that tube. Your cells produce them right now. Everybody in your family produces it. Everybody in your neighborhood, everybody in the US, everybody in the world. 7 billion people have what's in this bottle in them. They don't know what it is. You don't even know what it's called yet. I haven't even said what it's called. Doesn't matter. It's in you. It's absolutely in you. And this product can do things that nothing else can do because of that. What is it? So ASEA REDOX, and you can see the bottle and the tube of Renew, and then there's a serum for heavy-duty anti-aging, same technology. And you'll see there's a blank spot over here. I'll show you why in a minute on the right side. But ASEA REDOX Breakthrough was the world's first and only true cell signaling supplement. There's the new bottle, and it has the study on the back of it. We're going to go through the study results. Someone says, what is it? It's a cell signaling supplement. They say, what does it do? I'll say it turns on genes and enhances signaling in the body. Why do I need it? Because your cells are breaking down. Every day your cells are breaking down. When you're young, they're not breaking down so much. As soon as you hit puberty, they start breaking down faster. That's why a 20-year-old won't heal as fast as a 10-year-old. And a 30-year-old will heal as fast as a 20-year-old. And a 50-year-old won't heal as fast as a 30-year-old. And an 80-year-old won't heal as fast as a 50-year-old. That's why people slow down as they get older. It's why people have more diseases as they get older. It's why their skin starts to really change. That's why little kids can fall down and they get up the next day. They're not sore. You know, a 50-year-old falls down on the playground, they're in traction the next day. This supplement turns on genes and enhances signaling. It is a cell signaling supplement. That's what it is. There's real science behind this product, and some people want to know a lot more than others. For the people that want to know a lot more, no problem. There's resources for you. I'm going to give a simplified explanation. The REDOXdoc.com is a good resource. There are textbooks on it. I'm holding up one right now. It's kind of heavy. There are over 1,200 textbooks on redox signaling molecules. So if you want science, you can get it. But I'll tell you this, when my friend Debbie brought this to me, I didn't look at the business at first. I wish I did. All I cared about was my father. My father had a severe prostate issue, grave. And I wanted to know if there were studies on his prostate issue. There were not. And Debbie said to me, doesn't it really come down to two things? And it's true. Here's what it comes down to. For most folks, two simple questions. Will the product help me with my problem? And what are the risks? Can it hurt me? That's it. And maybe the third is the cost. But guess what? It comes with a money back guarantee. And a pharmaceutical company tried to buy this product. And the founders and the scientists said no. They were afraid that the pharmaceutical company would bury it or take it down the approval as a drug, which, it is not a drug. But if they took it down that approval, it would take 5 to 10 years to get it out for every single problem that it helped. And not only that, what do you think a pharmaceutical company would charge people for something that could help their body help itself, whether it was immune problems or digestive problems or cardiovascular problems or hormone problems? What do you think a pharmaceutical company would charge for that, for a month's supply? If it was a true breakthrough and they had it, they had control and they had the patents, no one else was getting it. You know what they would charge? Thousands of dollars a month. And if you didn't have insurance to pay for it or you couldn't pay for it, you were out of luck. That's what they were afraid of. So they decided to market it through word of mouth. This product, as an associate, costs $120 a month, actually less because you get free product when you're on auto ship. But $120 a month. And by the way, if that's a lot of money to you, all you have to do is tell a few people about it and the company will pay you for doing that and you get your product for free. I want to go through reason number 2. What are the risks? 3 things about this product that are really important, that are unlike drugs totally. Number 1, you can't be allergic to it. It's impossible. It's in everybody. I'll show you in a minute. 2, there's no toxicity to it. And 3, it doesn't interfere with medicines. The toxicity question. So medicine-wise, you don't have to stop what you're doing. You just baseline everything in your health. You fill out a health benchmark form, something like this, and benchmark everything in your health and just track your progress and watch what happens. You don't have to change your medicines or stop them. Like, it doesn't interfere with medicines. But the toxicity thing is important. Did you know any drug can hurt you, right? Because you could be allergic to it. You could take the proper amount and it could kill you, right? You could have a side effect from it. Every drug has a toxicity. But if you take too much more of a drug than you're supposed to, you will get sick. It's just a matter of how much more and how long before you get sick because your body's trying to metabolize these drugs. And you'll get sick at a certain amount. And there is an amount that will kill you. Every drug has a lethal dose. You can look up LD50, lethal dose 50. And this does not have a lethal dose. It's made from saline. Your body makes redox molecules from saline, literally, from salt and water. It's not salt and water anymore. If it was salt and water, it couldn't be patented, and you'd see the study in a minute on gene expression. But if you drink too much, your body turns it back into saline. It's an incredible safe thing. What are they? Well, in your cells, you have a nucleus. You have something called the mitochondria. And your cells are little sacks of salt water, by the way. They're saline. The mitochondria produces something called ATP. It's a molecule that we burn for fuel, adenosine triphosphate. This is the 4th time I'm doing this tonight, so bear with me. During the production of ATP, we've known all along that we also produce these little byproducts called reductants and oxidants, and that's where the term redox molecules come from. They're made from saline. They're not saline anymore because a reductant is a charged molecule. An oxidant is a charged molecule. Reductants are negative, oxidants are positive. It's been known that we produce this. When I was in school in the 80s, I was a biology major at the University of Maryland, podiatry medical school in Chicago. We were taught that these little things were just a waste product. They were harmless, but they were a waste product. The name of the game was ATP, and that was it. That's what the mitochondria did. We had no idea that these things were critical for health. Well, scientists have found they're foundational for cellular health. What does foundational mean? Foundational means you would die without it. Water is foundational. Air is foundational. Oxygen is foundational. Nutrition is foundational. Redox molecules are foundational, and your cells make them, but you don't make as much as you used to, and that's where the problem is. So scientists have discovered that redox signaling molecules help our cells do two things: hear each other, communicate, because it's important. You got to know when there's a problem in the body. If you don't hear that there's a problem, the immune system cannot take care of it, and they turn our genes on. As we get older, our genes start turning off and slowing down because of toxin, stress, and age. We'll go through that. Huffington Post, everybody's heard of Huffington Post. This is pretty powerful. You know, when breakthroughs come along, the public doesn't know about it, but the scientists do. Well, look what Huffington Post wrote last year. And if you're entrepreneurial and you're thinking about this as a business possibility, then this is really important. June 13th, 16, 5 emerging technologies in science that will shape our lives in the coming years. Here are 5 of the craziest game-changing technologies that are starting to take off in 2016. Pay attention. Some of these will shape our lives in the coming years. Now, pay attention to what it says there, starting to take off in 2016. Timing's pretty important in an opportunity. Now, these 4 things I didn't never heard of. I looked them up. I'm like, wow, that's amazing. I'd be interested in that. I'm not going to be able to profit from that without buying stock, but hey, organic electronics, nutrigenomics, synthetic biology, neuromorphic engineering. Never heard of them, looked them up, pretty fascinating. But I did know what number 4 was because I've been using the product for 6 years. Redox signaling technology, redox signaling molecules. And they show a picture of ASEA. Why do they show a picture of ASEA? Because ASEA is the only company that has it. This is fully patented. This bottle and the tube is fully patented. So for the opportunity people, and again, if you're not interested in the opportunity, forgive me, but there are a lot of people who are struggling or settling, and I make sure that people are aware of this opportunity. I want them to get better if they have health problems, but I want them to know there's an opportunity too. All right? So it's a breakthrough. Breakthroughs always sound too good to be true, right? What's the saying? A picture is worth 1,000 words, right? So picture Thomas Edison, the light bulb. He's trying to describe to people that they're not going to have to use candles anymore to light rooms or lanterns. Who's going to believe him, right? 1879, he's telling people he knows he's invented the light bulb. He knows it works. He knows they're all going to be using it. He's talking to 100 investors. They laugh at him. So what's the saying? A picture's worth what? 1,000 words, right? So he draws a picture of the light bulb. How many of the 100 investors are going to get involved? Probably none. They're not going to believe him because it's a breakthrough. They can't fathom it. They can't picture not using a flame to light a room. So far more importantly, I'm making a point here, far more importantly than words or pictures, an experience is worth 1,000 million words. Thomas Edison has those 100 people in a room. They don't want to invest. And by the way, we're not asking for an investment in this. There is no investment. It's $40 to become an associate, or it's free. Your host can tell you about that. But Thomas Edison says, okay, you all don't believe me? He's smiling just like I'm smiling. He says, would you all please blow out those candles? So everybody blows out the candles. Now they're standing in a pitch black room. Tom flips a switch. 50 light bulbs come on. The room is lit up. Everybody can see one another. They're trying to figure it out. Where's the flame? Guess what? They believe now. Why? Because they had an experience. And that's what we want to do with you. We want you to have a fast experience. And I'm going to show you how to do that. So redox, we say redox, see it and feel it right now. What do I mean by see it? The studies done on this for anti-aging, 28 days. People use it for wrinkles and cellulite actually too. And Dermatest is a gold standard lab in Germany. ASEA sent the product to them in 28 days. They gave it 5-star rating, which is their highest rating with 0 toxicity. There are a lot of products that will help wrinkles. Some of them are not so good. Some of them are acids. They're toxic. Some of them have something called oleander in it. Network marketing company has that. It puffs the skin up slightly. You can't tell it's puffing it, but it puffs it. It inflames it. And then the wrinkles look like they're better. Oh, I look so much better. They don't realize they've inflamed the skin. This does not do that. This is zero toxicity. It's made from salt and water, and it makes the skin actually fresh cells. What did they find in 28 days? A 20% improvement in wrinkle depth, overall wrinkles, facial skin texture, smoothness, elasticity, and 11% improvement in skin hydration. Pretty amazing. So people use it for wrinkles. I'll show you some pictures. People always use it for skin problems. I'll show you some pictures. But here's the thing. This is the big one. This is what makes it so fast. This is where if I'm sitting with someone who's struggling or settling and they don't believe what I'm saying, the sooner they have an experience with the product, the better. The drink, it could be 1 day, it could be 90 days, right? It comes with a 30-day money-back guarantee. All the products do. But you want to commit to give it 90 days. 4 ounces a day the first week. That's a bottle a week. If you're not seeing changes, temporarily double it to 8 ounces a day. Go to 2 bottles a week. Comes with a money-back guarantee. Order at least 8 bottles, 2 cases of the drink the first month. You get your money back if you don't see an improvement. We want you on it for 90 days. Comes with a 30-day money-back guarantee. So how can I pretty much guarantee that someone's going to see results? It's with this. For people that are hurting, we can't make any claims. We will not use the word pain. We'll just say hurting. People that are hurting, take the 10-minute challenge. Right? I shot a little video 3 times in 5 minutes. It's exactly that. You have discomfort in your body. Where is it? Knee, back, neck, whatever it is. Rate the discomfort on a 1 to 10. Move the body part. Range of motion. What's the scale that it hurts on a 1 to 10? Do a deep knee bend. See how far you can go if you have bad knees. Get a baseline number, and then you're going to give it 10 minutes, but you're going to do something in the first 5 minutes. What are you going to do? You're going to shake the tube up. You're going to put the gel on very gently, no massage, 3 times in 5 minutes. That's all you got to do. And how do you feel in 10 minutes? Now, do it to yourself right now if you're with your host on different areas of your body that may be stiff or hurting. Just do it. But if you're entrepreneurial and you want to validate that this is real, find 10 people as quickly as you can and invite them to your house next Thursday and do it, right? And you'll have the product. If you order it, you'll have the product by then. And ask them if they have anything that's hurting them. You want to build your belief and build their belief? I don't care if they're open-minded, skeptical, or cynical. As long as they're honest, you're going to see something amazing happen. Is it going to happen to all 10? Maybe. Is it going to happen to 9? I would say probably yes. And when you see it happen, it gets you excited. And I've seen people in the drink saying, some people say, I've had amazing results the first week or the first month. So you say, I'm not really sure, but I want to do this opportunity. I got to know if it's real. I'll say, well, have you brought this on 5 or 10 people that are hurting? No. Well, why do you want to make money? And they tell me why. I'm like, if I were you, I would take the gel and go try it on a few people. I mean, don't get caught up in your day. Make it a priority. Because they all come back and say, oh my God, I wish I did that the day I got the gel. That I promise you. Okay. So some real quick pictures. Then I want to get to the study. Before, after, this is 28 days. Sun damage, before, after, left, right. Young people don't get sun damage, do they? We'll explain that. This is a scientist in Norway. Even scientists want to look younger, right? Look at that. I mean, this is the fun part of this. This is not an older person, but this is a younger person. This is not a plague. This is not going to kill people. It's not going to make anybody sick, but it affects people's self-image. And I'll tell you, it's a gift to help kids with this, and adults too. It really, really is. And the study on cellulite, or cellulite, however you pronounce it. I do these European webinars. Everybody says it differently. 6-week trial, 10 to 12% decrease in fat lobule size. Again, this is not a disease. This is not going to kill anybody, but hey, women, sure, comes in handy in the summertime and they feel better about themselves. Left is before, right is after. Left before, right is after. Here's the one quiz of the night. Which one is me? I'm the top one. No, and I'm neither. Okay, biochemistry of this, here's 1,200 textbooks on this. I showed you one of them, right? There are journals dedicated to this. There's over now 16, it says 14,000, 16,000 articles, studies on redox signaling molecules at pubmed.gov, our nation's library of medicine. The ASEA science journey. ASEA does not have to send its product to third-party validators. It doesn't have to do that, but it does. And it sends it to gold standard companies to say, tell us what you find with this product. One is Stevens and Associates, one is the North Carolina Research Campus, one is Pacific Northwest National Laboratories, one is Dermatest, which you saw, and one is Bioagiletics. I'm going to touch Bioagiletics here. Bioagiletics, look it up. It's a company that certifies and validates. It's a third-party laboratory that validates for pharmaceutical companies that what they say is in their drug is in their drug. The FDA requires drug companies to do that. Requires them to the third party to say, you got this medication in there, we need validation. ASEA is not a drug, thank God. And ASEA does not have to send its product to Bioagiletics to verify its redox signaling molecules. But anybody that says it's salt water is either a cynic, or they're not paying attention, or they're guiding you to set, they're trying to sell something else. It could be another product, or it could be the pharmaceutical industry. A lot of websites are funded by the pharmaceutical industry, and they bash chiropractic, acupuncture, ASEA, juices, oils. You know, the farm industry likes the way things are now, put it that way. They don't want things to change. They want you going into that drugstore every month. The back of every bottle says Bioagiletics. The back of every tube says Bioagiletics. Why? Because ASEA sends the products to them every month to get certified that it's redox molecules. Here's the groundbreaking study, and this is why I'm taking a few extra minutes tonight. I'd be just about done, but here it is. Torrent Laboratories, look this up. This was just released last week. I'm on the medical professional board. I saw this about a month and a half ago. This is really powerful, guys. This is gene studies, genetic studies. Who is Torrent? Leading genetic research laboratory. They advance medical research through leading-edge genomic services, spearheaded projects leading to gene testing breakthroughs in multiple industries. Look them up. I'm not just saying this. You can look this up yourself. ASEA sends it to good people to test their product. Ken Ward, he runs this lab. He is boarded in 4 things, which is really kind of remarkable. Most people aren't boarded in more than 2. OBGYN, maternal fetal medicine, board certified in medical genetics and molecular genetics, pretty powerful. Dr. Ward was actually one of the key pioneers in Ancestry.com. You can look that up. But he runs this lab. They do genetic testing on lots of things, and they tested ASEA. Wait till you see what he said about it. The hypothesis of the study was, will drinking ASEA have a positive impact on gene expression in human cells? It's been theorized that it does, but it was never really known. So, and if you look at some of these textbooks, they talk about redox signaling. It's all theory that it does that, right? So ASEA has seen the results of what the product does, so they wanted to see, is it affecting gene expression? Well, first of all, what is gene expression? Let's have some really quick definitions. What are genes? Within each cell of the body is the nucleus. It's the cellular brain that contains information about specialized function of that cell. That's what genes are. They carry everything. They carry our eye color. They carry everything about us, but they also have instructions on what our cells are supposed to do. This information is contained in genes, small coding segments of DNA. What is gene expression? Because that's what the study was on. It's the process by which genes direct cellular function. The genes have to tell the cells what to do. If you have a liver cell, the gene has to tell it what to do. You get a brain cell, the gene has to tell it what to do, right? Complicated series of reactions without which our cells would be unable to perform life-sustaining tasks. Life-sustaining tasks. If your genes aren't working properly, you're going to have problems, right? The study overview was an 8-week trial. It was reviewed and approved by an independent review board, randomized, double-blind, placebo-controlled study. The design, 60 participants, 41% male, 59% female. Mean age was 35. This is important. They didn't do this on old people. The mean age was 35. That means if this had a positive effect on genes of a healthy 35, these were healthy people. If it had an effect on healthy people, a lot of people who are healthy today end up not being healthy down the road. And again, the problem that arises didn't arise when they're 50 or 55. It was there for a while. It just finally hit the surface, right? Well, if you see a change in healthy 35-year-old, mean 35-year-old people, and you see a change in genetic expression, that's very powerful. Because a lot of people say, I don't need it, I'm great, I feel fine. Well, I'll tell you what, you fill out this benchmark form and you'll probably find reasons why you should use the product, to try it at least. And really young people, even young people that have really no issues yet, when they see this, they realize things are changing in me since puberty. So I'm not healing as quickly as I did when I was younger. So the study design, 60 participants were split into 3 groups. What are those 3 groups? 25 in the active group, they drank ASEA. 25 in the placebo group, they drank salines, just salt water, and 10 didn't do anything. The saline solution, by the way, was the exact saline solution that is, I'll show you the inside of the plant in a minute, the exact saline solution that ASEA uses to make ASEA before it's made, because it takes 3.5 days to turn it from saline into redox signaling molecules. Each participant drank 8 ounces a day, 4 ounces twice a day. Participants' blood was drawn at week 0 and week 8. In fact, after the study, it was drawn at week 16 too. We'll show you that. Genetic expression levels were tested and analyzed. Get this, this is serious. Genetic expression levels were then tested and analyzed using specialty equipment and a process called Affymetrix Prime View Array. You can look that up. The results: in 8 weeks, 20 to 31% beneficial change in gene expression in 5 genes that are all involved with pathway signaling. Now, that may not make sense to you. I'm going to try to break it down for you. Stable gene expression changes over that period. So you're going to see in a minute, every person had a change. Of all the people, that 25 people that were on ASEA, everyone had a change, every single one. And it was at 20 to 31% beneficial change. That's remarkable. 5 genes that play a significant influencing role in 5 areas of health. So what I'm saying here is these 5 genes, they've been mapped. Scientists know what they control in your body. They couldn't control them, but they know what these genes direct your cells to do. What is it? Look at the circle. Look at the little pie here. Look at 11 o'clock. Innate immune system pathway. Do you know anybody that has immune problems? Vascular health signaling pathways. If you go over here, it says activating vascular health maintenance and elasticity, reducing heart disease. Also that gene. Digestive enzyme signaling. You know, it has you or somebody you know, digestive problems, hormone problems, inflammation. If your joints hurt and you put the gel on and you're not hurting right now, guess what we're talking about? There you go. It's pretty amazing. These 5 genes play a key role in activating dozens of other genetic pathways that can significantly impact human health. Okay, well, one of the genes is EGR. It's known what it does. Look how complicated this is. You don't know that EGR is controlling these things: ovarian infertility genes, spinal cord injuries, interferon alpha beta signaling, insulin signaling. This is circadian rhythm. That's sleeping, right? This is remarkable. It's proven that drinking ASEA turns these genes back on that have been turned off by epigenetics, environmental factors, toxins, stress. Absolutely amazing. Guess what? Week 16, they tested them again. You know what happened? The beneficial effects were gone. You have to keep drinking this product to get the benefits. You produce less and less of these molecules when you hit puberty, and throughout your life, you're raising the levels back up. If you stop, you just go back to where you were. That's the business opportunity, by the way. Product works, safe, patented, and you have to consume it. And ASEA is the only company that has it. These are just the results, just reiterating the results. The last one's pretty important. Effects are non-specific to race, sex, or age. People are people, cells are cells. That's what it is. This product works on 7 billion people in the world. 20 to 31% positive shift, again, immune system, inflammatory response, cardiovascular health, digestive enzymes, hormone balance. One product. What's the significant takeaways? Who do you know that has digestive problems, inflammatory problems, hormone problems, cardiovascular problems, immune system problems? Pretty remarkable. One product. You still need nutrition. This is not nutrition. This is the breakthrough. It's something completely different. What did Ken Ward say about this, who runs that lab? These results are unique and exciting. ASEA is a signaling supplement, and the pathways expressed are signaling genes. Pretty powerful. Why do you need it? Because our cells break down. When we're young, we produce a lot of redox molecules. When we hit puberty, we produce less. When you have problems in your body, 911 is called, the immune system is called, and if the immune system can hear the call for help, it comes. Redox molecules amplify the signals. Very loud signal when you're young. As you get older, you produce less and less and less and less. So the signal's very loud for young people. This older lady falls down. She's very happy. She falls down and has an injury. She's not going to heal fast. Why? Because her redox molecules levels are low, and the call to the immune system is going to be, and from the genes is going to be very, very quiet. Very remarkable. We share experiences all the time. Ask your host what they've seen. Ask the other people who put the gel on at the house right now. what they felt with their discomfort, and you're going to be stunned. Not everybody, but pretty much everybody's going to be very, very happy. Quick 10 facts about the company. It's 7 years old. That's the world headquarters. It's brand new. They just built a new facility. It's 7 years old now. That's in Pleasant Grove, Utah. It's run by a highly experienced and conservative management team. These are not crazy people. These are incredibly brilliant people. Don't have time to go into their bios, but remarkable people. They were not network marketers just trying to make a fast buck. They had to use network marketing because when they turned down the offer from the pharmaceutical company, they didn't know what to do. Word of mouth works, and you're going to see how well it works. They were profitable in the first year of business. They have zero debt. All the product for the entire world is produced in that building right there. It's down the street from that other building. That's inside the facility. There's the saline tanks on the left. There's the electrolysis machines. It takes 3.5 days to make the product. There's the bottling. There's the packaging. There's the finished product. So what's the company done so far? They have 13 distribution centers in the world. Now they're well over 30 markets because they just opened 5 countries in Europe. It started in the US in 2010 officially. I went into Canada, Mexico, 20 countries in Europe. Now Poland just opened 21. We're in Australia, New Zealand, and now in Asia. Hong Kong, Singapore, Thailand, Taiwan, and Philippines. I don't know if you know this or not. If you know network marketing, Asia is the largest network marketing market in the world. Everybody in Asia is made up of cells. Everybody there has genes that are being turned off. This product works as well on Asians as Americans. It works as well as Europeans as South Americans. This product works. They've done 400 million since the launch. Last year they did 80 million. This year they're going to do 100 million, over 100 million. They've grown every single year. Conservatively, no wild growth yet, but projected because of Asia and now South America, and because of this study, because it's simplified the messaging now, it's a cell signaling supplement. It's projected they're going to do 200 million in 2018. And mark my words, in 3 or 4 years, we're going to be at $1 billion. And there's only one network marketing company that's ever hit 10 billion, and that's Amway. The other big ones were New Skin and Herbalife. This company is going to be a $10 billion company. This is a serious product. This is a breakthrough for humanity, and we need your help getting the word out. And the company is going to pay you to help get the word out. That production facility did 80 million last year. Running part-time, running batches. If it runs 24/7, it can produce 800 million. And they can see the blue floor on the bottom left pictures. There's parallel, that blank space. They can put a separate production line in of the electrolysis machines, tanks, everything. They can double output in 3 weeks to get the equipment in and running. No supply chain problem. They make it out of salt and water. Morton's kosher salt, pure sodium chloride, and they get deionized water. Purest water you can get. That's how they make this product. That's how they have to make it. They can't make it with anything else. It has to be sodium chloride and water, and yes, it's kosher. The opportunity, we're post-risk, we're 7 years old, there's no risk left here at all. We're entering the momentum stage of growth. That means things are going to start really flying, and it's fun to be a part of it when it's flying like this. It's really, really exciting. They pay us to acquire customers and then to find, enroll, train, and support entrepreneurs. Most people enroll as an associate for $40 or free to get the product. You're just a glorified customer, really, but they give you a free website. And if you want to build a business, then we'll help you when we direct people to your website. They go to your website, they can order a product as a customer or as an associate because they save money as an associate. It's much better to be an associate. And when you're an associate, again, it's $40 or it's free. They give you a free website. So people go to your website to order product. The company puts money in your bank account. Where does the money come from? 50 cents of every dollar goes into the compensation plan that they make. 80 million last year they made. 40 million went into the compensation plan. Excuse me. Talk fast like this for 40 minutes and you run out of steam after 4 of these. Excuse me. So they spend no money on advertising. 50 cents of every dollar goes to us. So you're an associate, right? This is simplified. People go to your site, say they become associates, say they're 10 associates. Every time they get their product, remember, if you stop taking it, you go back to where you were. So they're on auto ship. The company ships product to them every single month. They can cancel it whenever they want, but they accumulate these loyalty points they can cash in for free product, right? So every time they get their product, the company pays you. But let's say these 10 people are struggling or settling, and they each tell 10 people. Now there's 100 people on the product. Your 10 people get money, company pays them, but they're going to pay you because they would not have got to those 100 people if it wasn't for you telling those 10. Now those 100 people tell 10 people. Now there's 1,000 more people. They're paying you for all of this. This is passive income, everybody. This is freedom. When you have money coming when you're sleeping, I educated people about this 6 years ago. I'm still getting paid on it. Some of them are customers. Some of them are telling people about it. The ones that are building a business, I still talk to it because they call me for help, right? They're inviting people to their homes like tonight. We had about 500 people have in-home events tonight, and they had people in their house. So some people had none, just them, but some people had 20 and 30 people in their house to hear this. This is catching on. This is going to grow. We're at the beginning of this. It's passive income, and it's a beautiful thing when you know that it's a patented product. There's something here for everybody. It depends on what you want. You want better health, look younger, be a customer. It's great. Refer people to us. You want to make some extra money as an associate? Tell a few people you get your product for free. Tell a few more people you can maybe get your car payment paid. Help find a few people that really want to roll with this. You can make some serious money. You can make 6 figures or 7 figures residually. I made good 6-figure income as a doctor, but it wasn't residual. I was on that treadmill, and I was going to be on it till I was 70, right? This can give you freedom. It's not get rich quick. You know, nobody's stocking the garage full of product to sell. You just buy product for yourself to use, right? You share it with people. It's not expensive. Some people get on the product. They tell people. It is a wonderful way to make a difference in the world and make a lot of money if you want. 2 more slides. Comp plan, I'm not going into it. When you think of the color green, people think of money sometimes, or trees, but let's say money, green, money, right? Well, in this case, black means money, but green means money and time, because these 8 ways you make money in this business, the green ones are residual income. And that means you get free time. You make money when you sleep. You make money when you vacation. You make money when you're away taking care of a sick relative. You don't have to worry about your work because you've built something, and you build it on the side. You put 10 hours a week into this business. Find 10 people who put 10 hours a week. Now you're getting paid on your 10 plus their 100. That's 110 hours a week. You can't work that much. Guess what? Those 10 people tell 10 people, and they put in 10 hours a week. That's 10,000 hours a week you're getting paid on. This is not everybody's going to do that, right? And you don't have to have everybody doing it. But it's passive income, and that is such a gift. It is such a joy to go through life and say, I don't want to work today. You know what? I want to go golfing. I want to go camping for a few days, because you have a support team to help you and help support your people. But when you work, and you do it part-time. You do it for 3 years, sometimes 1 year, and you have choices. Do I want to keep my full-time job? Heck, I'm making 6 figures a year in this residually. I want to make more. You can do it. You have some choices, and that's the beautiful thing. It gives people choices. My last slide is this. This is a breakthrough. 2 important questions for you. Number 1 is, what do you want the product to do for you or someone you love? Take the business out of it. What do you want the product to do for you or someone you love? Talk to the person that introduced it to you. Get your questions answered, get on the product, and enjoy the product. If number 2, you answer no, you don't keep your eyes open for passive income streams, then you can refer people. I'm sure if they help you or your daughter or your son or your mother, you have no problem referring people. We are looking for people that need this product, and we're looking for people who are motivated, who want to change their life. That's what we're looking for, both types of people. We want people to join our team, and we will help them make money and help people. Your next step, the last part of this is, hey, get your own account. Order and start testing the product. Do not order it from online, third party. You'll find some on eBay or sometimes Amazon. Don't order it there. It's not coming from the FDA registered facility. That is a big deal that facility is FDA registered. Most supplements are not. Almost all of them are not. This is an FDA registered facility, NSF certified facility. You want it coming through that distribution channel, so you're not getting expired product, you're not getting tampered with product, you're not getting product that's been sitting in hot sun, you're not getting in direct sunlight. It's okay in the box, but not in direct sunlight, the package, the bottle and the tube. And now in Europe, they're finding some tampered with product. People are using heat guns to loosen up the wrapping and filling it with salt water. Get it through your associate, number 1, out of courtesy, but out of safety for you. And it comes with a money-back guarantee as well. And you can make money. You can get your product for free if you're an associate, because you tell a few people, the company will pay you. All right. ASAP, come to know that it's real. A lot, if you're looking at it as a business, a lot hinges on this. Benchmark your health before you start. Use ASEA and Renew 28 for 90 days. But do the 10-minute challenge on 10 people. Put it on 3 times in 5 minutes on people that are hurting and watch the magic happen. When you're ready to roll with this, one of the things there are many ways to build this, but a simple way is to invite people to your house. Give them an experience. Play a short video. You're going to have an expert Zoom in at 7:30 Eastern, Central, Mountain, Pacific every single Thursday night. You can do that. You host one in your house every Thursday night. How long do you do that? You do it until one of the people come and say, hey, Stuart, I want to do one in my house. Hey, Jacqueline, I want to do it in my house. Then go to their house and help them. Make Thursday night your business build. It's your freedom night. It's the night that you can use to build your freedom in your life. We will be there to help you. Okay? I'm going to stop sharing my screen, and I'm going to say goodnight to everybody. I know I went a little long because of the study. I got to cut some of my slides out. I apologize. We will do this again next Thursday evening. God bless you. Please, when you see this product work, share it just because you want to share it from your heart. If you want to have a better life financially and time freedom-wise, we want you to join our team. Okay? Have a great, great evening. Thank you all.